Hello, medical coding students. Today we're diving into one of the most critical areas of medical coding, neoplasms in ICD-10-CM. This topic may seem complex, but by the end of our session, you'll feel more confident in identifying, classifying, and coding neoplasms accurately. Remember, this isn't just about getting codes right. It's about ensuring patients receive proper care, that treatments are correctly documented, and that insurance claims are handled efficiently. Let's start by understanding what neoplasms are. Neoplasms are what we commonly call tumors. They occur when cells in the body start growing uncontrollably. Think of it like a garden. You want your plants, cells, to grow in an organized way, but sometimes weeds, tumors, pop up and start taking over. These tumors can be either benign or malignant. Benign tumors are like well-behaved weeds. They grow slowly, stay in one place, and usually aren't life-threatening. They're contained and don't spread to other parts of the body. Malignant tumors, on the other hand, are like invasive weeds that grow rapidly, invade surrounding tissues, and can spread, metastasize, to other parts of the body. These are life-threatening and require immediate medical attention. In ICD-10-CM, neoplasms are covered in Chapter 2, with codes ranging from C00 to D49. The key to accurate coding here is understanding whether the tumor is benign or malignant, as well as identifying its specific characteristics and its location. Malignant neoplasms can spread and disrupt normal cell growth, while benign ones are usually contained within their original site. Before we move forward, let's talk about the importance of thorough documentation. The accuracy of your coding heavily depends on the details provided in the medical records. When coding neoplasms, you need to look for specific details such as the exact site of the tumor, whether it's on the right or left side, the behavior of the tumor, malignant, benign, uncertain, or unspecified, and any related complications like metastasis or fractures caused by the tumor. Without these details, choosing the correct code becomes challenging, which could negatively impact patient care and the accuracy of insurance claims. Here are some key terms that will help you as we explore this topic. Morphology refers to what the tumor looks like under a microscope. Is it well-defined or irregular? Understanding the tumor's morphology helps in determining whether it's benign or malignant. Metastasize is the process by which cancer cells spread from the original tumor to other parts of the body, similar to how invasive weeds spread throughout a garden. If a tumor is described as encapsulated, it means it's surrounded by a protective capsule, which is typical of benign tumors and helps keep the growth contained. A biopsy is a diagnostic procedure where a small piece of tissue is removed from the tumor to determine whether it's benign or malignant. Think of it as checking if a weed is harmless or harmful. Now, let's talk about the neoplasm table, a key resource in ICD-10-CM coding. It is located after the alphabetic index. Go ahead and find it in your coding manual and tab it for easy access. The neoplasm table is a specialized reference tool found in the ICD-10-CM manual. It's organized by anatomical site and categorizes neoplasms into 6 different columns based on their behavior: malignant primary, malignant secondary, carcinoma in situ, benign, uncertain behavior, and unspecified behavior. Instead of searching through pages of codes, you can quickly reference this table to locate the appropriate code for the specific type of neoplasm you're dealing with. This table ensures that you consider the behavior of the tumor, whether it's malignant, benign, or uncertain, and it helps you apply the most accurate code based on the tumor's site. Using the neoplasm table is straightforward once you know what to look for. You start by looking up the main term related to the tumor in the alphabetic index. For example, if you're dealing with a breast tumor, you might start by looking up neoplasm breast. The alphabetic index might direct you to the neoplasm table, where you'll find the anatomical site of the tumor, like breast, listed across 6 columns. Each column corresponds to the behavior of the neoplasm: malignant primary, malignant secondary, carcinoma in situ, benign, uncertain behavior, or unspecified behavior. After selecting the appropriate code from the neoplasm table, it's crucial to verify it in the tabular list. The tabular list provides the full code description along with any additional guidelines, symbols, or notes that might affect the final coding. Knowing how the tumor behaves is key to coding it correctly. You may want to write it in your manual to refer to until you have memorized the behavior of each type of tumor. Malignant tumors include primary cancers. This is where the tumor started. Secondary cancers is where it has spread. Carcinoma in situ means the tumor is still in its original spot but could potentially spread. For example, if cancer starts in the lung and spreads to the brain, you would code both the lung cancer and the brain metastasis. Benign tumors, on the other hand, don't spread and usually remain localized. However, if they're in a sensitive area like the brain, they may still require treatment. When coding neoplasms in ICD-10-CM, it's crucial to understand the difference between uncertain behavior and unspecified behavior in the neoplasm table. Uncertain behavior refers to a tumor that shows some signs of malignancy, but isn't definitively classified as benign or malignant. The pathology report suggests the tumor could potentially become cancerous, but there's not enough evidence to confirm this. Essentially, the tumor's behavior is unclear. Unspecified behavior occurs when the medical record doesn't provide enough information to determine the tumor's behavior. It doesn't mean the tumor's behavior is ambiguous like an uncertain behavior. Rather, it indicates a lack of detail in the documentation. This often happens when a clinician notes the presence of a tumor but doesn't specify whether it is benign, malignant, or uncertain. In such cases, coders must use a code from the unspecified behavior category in the neoplasm table. It's crucial to remember that using an unspecified behavior code should generally be a last resort. When possible, coders should seek clarification or documentation to determine the tumor's behavior more accurately. Relying on unspecified behavior codes can lead to ambiguity in the patient's medical record, which might affect patient care and insurance reimbursement. Sometimes, the specific type of tumor, known as histology, is critical in determining the correct code. Histology refers to the microscopic structure of the tumor. For example, adenocarcinoma of the lung would be coded differently from squamous cell carcinoma of the lung, even though both are primary lung cancers. If the documentation includes these histological details, it's important to select a code that accurately reflects both the histology and the anatomical site. In many cases, ICD-10-CM guidelines require establishing a causal relationship between the neoplasm and any associated conditions. For example, if a neoplasm causes complications such as ascites or pleural effusion, the neoplasm should be coded first, followed by the code for the complication. Always be vigilant in identifying and coding these causal relationships as documented. The sequencing of codes is especially important when dealing with multiple neoplasms or complications arising from a neoplasm. The primary diagnosis, often the primary malignant neoplasm, should be listed first, followed by any secondary conditions like metastasis or complications such as a pathological fracture. Proper sequencing ensures that the patient's clinical scenario is accurately represented, which is vital for appropriate treatment and reimbursement. Additionally, pay attention to code first, or use additional code notes in the ICD-10-CM manual, as these indicate the correct sequencing order for related conditions. Sometimes, you'll need to use additional codes to capture the full picture. For example, if the neoplasm has metastasized, you'll need a secondary code to indicate the site of the metastasis. Also, if the patient is undergoing treatment such as chemotherapy or radiation therapy, or if there are associated conditions like anemia due to malignancy, these should be coded as well. The tabular list often includes notes indicating when additional codes are necessary, so be sure to review it thoroughly. Z-codes are particularly useful in documenting a patient's history or ongoing treatment for neoplasms. For instance, if a patient has a history of cancer but no longer has the disease, you would use a Z85 code to indicate the history of the malignant neoplasm. Additionally, Z codes such as Z51.0 for anti-neoplastic radiation therapy or Z51.11 for anti-neoplastic chemotherapy are used when the focus of care is on the treatment itself rather than the malignancy. When coding in situ neoplasms, it's important to recognize that these tumors are localized and have not yet invaded neighboring tissues. They are at an early stage, which affects the treatment approach and prognosis. In ICD-10-CM, in situ neoplasms are coded differently from malignant neoplasms and are found in the D00-D09 range. Accurate coding of in situ neoplasms is crucial, as it reflects the early stage of the cancer. Although ICD-10-CM does not directly include codes for tumor staging, understanding staging is essential, especially when dealing with complex cases. Additionally, tumor markers such as PSA for prostate cancer or CA-125 for ovarian cancer often appear in medical records and provide context for the severity and extent of the neoplasm. While tumor marker results themselves aren't typically coded in ICD-10-CM, they are important in understanding the overall picture and guiding treatment decisions. It's also important to code any complications that might arise from neoplasms, such as anemia, infection, or cachexia, severe weight loss and muscle wasting. These conditions can have a significant impact on the patient's health and treatment plan, so they should be documented and coded separately when present. Always look for any notes in the tabular list that guide you on how to code these complications alongside the primary neoplasm code. Beyond the technical aspects of coding, it's essential to ensure that the documentation in the medical record supports the codes you assign. This means not only relying on the physician's notes, but also verifying that all relevant clinical details are documented according to coding guidelines and regulations. Poor documentation can lead to coding inaccuracies, denied claims, or even compliance issues. So always prioritize thorough and accurate documentation. Accurate coding, particularly in neoplasms, directly impacts patient outcomes. Proper coding ensures that patients receive the right treatments and follow-up care. Coders play a crucial role in the healthcare system, and understanding this can give you a sense of the importance and responsibility of your work. Every code you assign contributes to the broader picture of patient care, so precision is key. Your coding should align with medical necessity and payer coverage policies, which dictate what treatments are considered necessary and what will be reimbursed. Understanding these policies helps ensure that claims are processed smoothly and that healthcare providers receive appropriate payment for the services they provide. As a coder, it's important to code based on the documentation provided and to resist any external pressures to code in a way that could lead to inappropriate reimbursement or misrepresentation of the patient's condition. Upholding ethical standards ensures that the coding process remains honest and accurate, which is crucial for the integrity of the healthcare system. Neoplasm coding in ICD-10-CM often interacts with other coding systems, such as ICD-10-PCS for inpatient procedures and CPT for outpatient procedures. Understanding how these systems work together helps ensure that all aspects of a patient's care are documented and billed comprehensively. Coding rare or complex neoplasms can be challenging due to difficulties in finding the correct code, interpreting complex pathology reports, or dealing with insufficient documentation. To overcome these challenges, always refer back to the coding guidelines, consult with colleagues or supervisors when necessary, and use available resources like the Coding Clinic for additional guidance. Some common errors in neoplasm coding include incorrectly sequencing codes, failing to code secondary conditions, or misidentifying the primary site of a neoplasm. To avoid these mistakes, always follow the steps we've outlined today, verify codes in the tabular list, and ensure that the documentation supports your coding decisions. Neoplasm coding can also vary depending on the patient population, such as pediatric patients, pregnant women, or the elderly. Each of these groups may have specific coding considerations, such as how pregnancy might affect the classification of a neoplasm or how age-related factors influence tumor behavior and treatment. Be mindful of these nuances when coding for special populations. Let's apply what we've learned with a case study. Our patient has been diagnosed with breast cancer that has spread to the bones. The patient is also suffering from severe anemia due to the cancer, and they have a pathological fracture in their femur due to the metastasis. You would begin by coding the primary malignancy, which is breast cancer. You'd find this in the neoplasm table under breast malignant primary, leading you to code C50.9 if the specific location within the breast isn't documented. Next, you would code the secondary malignancy for the metastasis to the bone. In the neoplasm table, you'd look under bone malignant secondary, which would direct you to code C79.51 for the bone metastasis. The pathological fracture due to the neoplasm needs to be coded as well. You would use M84.5, pathological fracture in neoplastic disease, but remember to specify the location of the fracture, such as M84.551 for a pathological fracture in the femur. Finally, you'd code for the severe anemia due to the malignancy. You can find this in the alphabetic index under anemia in neoplastic disease, which would direct you to code D63.0. After selecting all the codes, you would verify each in the tabular list to ensure accuracy and then sequence them correctly. Keep practicing. It will help to practice coding a variety of neoplasm cases, including primary and secondary malignancies, benign tumors, in situ neoplasms, and cases with multiple complications. Practicing will reinforce the concepts we've discussed and prepare you for the complexities of coding in a clinical setting. Finally, let's briefly consider the future of neoplasm coding. Emerging technologies like AI and machine learning are starting to play a role in the coding process, potentially automating some tasks or providing decision support. Additionally, keep in mind that updates to ICD-10-CM or the eventual transition to ICD-11 could change how neoplasms are coded. Staying informed and adaptable is key to thriving in this evolving field. Let's review what we have learned. Understand the behavior of the neoplasm. Is it malignant, benign, uncertain, or unspecified? Use the neoplasm table to find the correct code and always verify it in the tabular list to ensure accuracy. Pay attention to sequencing rules and the use of additional codes, especially in complex cases where there are complications like fractures or secondary metastasis. Ensure documentation integrity by verifying that the medical records support the codes you assign. Proper documentation is crucial for compliance, accurate billing, and patient care. Stay informed and ethical in your coding practices. Understanding medical necessity, payer coverage policies, and maintaining ethical standards are key to successful coding. Accuracy in coding ensures patients get the right care, healthcare providers are appropriately reimbursed, and the healthcare system operates smoothly. Keep practicing, refer back to your resources, and don't hesitate to ask questions. With time and practice, you'll become a pro at this. Thanks for joining me today. I hope you're leaving this session feeling more confident and ready to tackle coding neoplasms. Keep up the great work, and I'll see you in our next session.